Hello everybody, welcome to the Thursday edition of Video Clips, and I want to talk about water today. Drinking enough water every day is just as important as choosing the right foods. And notice I always have water right here. I'm drinking in between filming these video clips and sipping on water all day long. But we often overlook hydration when we're looking at food journals and providing advice about how to improve health. Dehydration is a serious issue. It's been shown to negatively affect mental, physical, and emotional health. Being dehydrated by just 2%, which is certainly not hard to do in the hot summer months like right now, can result in worse performance in tasks that require attention, motor, and immediate memory skills. Mild dehydration can cause reduced alertness, inability to concentrate, fatigue, headache, and reduced exercise capacity. In fact, we could probably write a whole textbook about how important it is to drink water and the bad things that happen when you don't do it. There are some other articles on this topic, by the way, posted in the Health Briefs online library, a couple of which address the increased risk of cardiovascular events when people are dehydrated. Some really good studies that have identified dehydration as a risk factor. Well, I want to talk a little bit about hydration status in people who are obese because they need more water than normal weight individuals, and the reason is that water needs vary based on metabolic rate, body surface area, body weight, and the amount of food consumed. Now, the Institute of Medicine provides some guidelines for how much water or fluid to drink. They really look at everything as the equivalent as long as it's fluid in addition to food. I'm pretty clear on the idea that this needs to be water, not Gatorade and soft drinks and juices and that sort of thing. But here is the IOM recommendation. Adult males need 16 cups a day, 13 as liquid. Adult females, 11 and a half, 9 cups as liquid. Now, these are recommendations for normal weight people, and there's nothing. I looked at the site, could not find anything that showed an increase for obese people. Actually, there wasn't even much about increasing for hot weather and exercise and that sort of thing. Research shows an association between inadequate fluid intake and higher BMI and obesity both. One research group found that adults who were dehydrated in general had a higher BMI than those who were hydrated, and that dehydrated adults were more likely to be obese. Now the question is, which comes first? Does dehydration add to the obesity, or does the obesity cause the dehydration because water needs are greater, and nobody's telling these patients that. The researchers noted that the reason could be inadequate water intake, but could also be due to differences in food intake. So if you eat a lot of fruits and vegetables with your calorie dilute, they have a lot more fluid in them versus if you're eating a lot of higher calorie dense foods that are not so high in water content but high in fat in particular don't contain as much water. There's another thing that goes on too, which is that people often think that they're hungry when they're actually thirsty, and it may be that responding to this inaccurate signal by eating more food is part of the problem. One thing I'll mention about this is that there is a hormone related to hunger. It's called ghrelin, G-H-R-E-L-I-N. And one thing we know about people who eat themselves into obesity is their ghrelin levels don't rise and fall like they should. So often this issue of not knowing when you're hungry is an important one, and we have some strategies for dealing with that go beyond this talk, but this research is identifying a problem, which is not knowing when you're hungry. And whether or not it's due to needing more fluid, who knows, but we do know that not knowing the hunger signal well or not having those hunger signals be accurate is an issue. For this study, lead researcher Tommy Chang wrote, quote, "Our findings suggest that adequate hydration may play a role in weight and prompt further discussion regarding adequate hydration during weight management counseling." Now, specific instructions about water drinking are not in most dietary plans, certainly not in most weight loss plans. They have always been part of our plan. Our recommendations have been clear. Drink at least 64 ounces of water if you're an adult every day, half of the weight in ounces for children, more if you're exercising outside. I mean, on Saturday here in Ohio, it was 92 degrees. I was up in Port Clinton during that period of time, and it was very humid. You could work up a sweat walking to the end of your driveway. On days like that, you have to drink a lot more water. And I went to an outdoor exercise class for 90 minutes. I was drinking water like a madwoman all day, but you have to remember to do it, but very, very important. So water intake from food, by the way, many people are told if you're eating a plant-based diet, you don't have to worry so much about fluid intake. Study after study has shown that that's not the case. You do have to worry about fluid intake, and again, the IOM basically says any fluid will do. I don't agree with that. I think water is the best way to hydrate. Okay, next topic, communication between patients and their oncologists. And this is an area that is discouraging, but it could be fixed very easily, actually. According to a study of cancer patients and their oncologists, there is a big difference between what cancer patients expect from treatment and what their oncologists expect from the very same treatment with regard to survival outcomes. Now, it's important because it represents that there's really not clear communication between patients and their doctors. And if patients don't understand or know factually the potential results of various treatment options that they're given on survival, they can't play an active role about making decisions about their care. This particular study included 236 patients and 38 oncologists who agreed to participate in the study. The purpose of the study was to identify ways to improve communication. The patients in the study all had advanced cancers, and their oncologists had agreed, part of the criteria, they wouldn't be surprised if the patient were to die within the following 12 months. Patients and doctors were asked about the likelihood of 2 years survival, and out of the 236 patients, 161 patients, their expectations were not in alignment with their oncologist's expectations. Almost all the patients in the discordant pairs, 155 of them, had a more optimistic view of what outcome they should expect than their oncologists, and they also did not know that their oncologists thought differently than they did. Now, the discordance did not differ based on income, education, sex, confidence in the patient-doctor communication, oncologist confidence in their own end-of-life communication skills, or the extent of communications between patients and their doctors. Almost all cases involved patients who had they had said, I want to be actively involved in making good decisions on my own behalf, and they wanted to have more focus on quality of life toward the end of life, but that would be difficult to have much input if you didn't know when the end of life was going to be. This isn't the first study that has shown this type of result. The authors of this article that reported this study cited several others. One was the support study, which concluded that the most fundamental medical choice patients with incurable cancer face, the decision between life-extending therapy and comfort care, may be highly influenced by their understanding of their prognoses. Very, very important. Gilbert Welch, in his book, Should I Get Tested, or Less Medicine, More Health, was the book where he talked about this, talked about lung cancer patients undergoing treatment and what many of them said after the treatment. If they had known certain facts about the treatment, a significant percentage of them would never have agreed to that treatment. The researchers noted that sometimes informed and shared decision-making can result in patients knowingly disagreeing with their oncologist. This is called known discordance. And in Dr. Kelly Turner's book, Radical Remission, she reports on some patients who were given horrible prognoses, and these patients said, I'm not listening to that, I'm planning to live. A lot of them, though, did not continue traditional treatment. But unknown discordance results when patients mistakenly think that they hold the same view as their prescribing oncologist, which is indicative of failed communication. The distinction is really important because how is a patient supposed to take control of healthcare decisions, end-of-life healthcare, if they're operating under the wrong information? Researchers cite studies showing that optimistic views of treatment outcomes leads to an increased likelihood for choosing aggressive treatments, particularly for advanced stage patients, and that's terrible. And that's where Gilbert Welch's information came from. Lung cancer is usually fatal, and many of the patients in a study that he cited in that book said, had I known that this wasn't going to lead to survival, I never would have agreed to do it. So we definitely need some improved communication. I talk all the time about informed medical decision making, but it's inexcusable for oncologists not to just state clearly what the outcome is going to be when they're talking to patients, or the suggested outcome. I have heard, not through the grapevine, members here telling me that when they've asked their oncologist, they've heard things like, we don't want to worry you with that. And one of our members told an oncologist, I'm kind of worried right now with the stage 4 cancer. I don't want you to worry about worrying me. I want you to give me information. But it's almost that aggression, that aggressive approach that's required to get the information from the oncologist. So anyway, it shouldn't be that way. Oncologists should be forthcoming so that informed decisions can be made. And it's true. Many people would probably say no to many things. I don't know if this is motivated by a desire to not lose business, but whatever the motivation, it isn't right. It needs to change. All right? In the meantime, we'll keep pushing people to ask doctors for information so that they get to know the stuff up front so they can make informed decisions. But somebody asked me the other day, when all this informed decision making takes on, you'll be out of business. And I think I'm intelligent enough to figure out something else to do with myself, to make myself useful in the world if that happens. But I don't think we should hold our breath on that for right now. We'll keep doing what we're doing. All right, that's all for today, all for the week. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you next week with more news.